name is Christian. I'd like to thank you for taking the time to listen to me today. I'd like to talk about the growing lack of purpose in our society, some causes, and some worthwhile strategies to consider. We've all faced some type of problem in life where we didn't see the purpose of what we were doing, be it school, a job, or even an entire path we thought we'd mapped out so well for our own future. Some people seem to handle all levels of crisis situations well, while other people don't fare quite so well. Many people are doing well, yet are one or two unlucky breaks from life completely changing and causing people to feel like they've lost their purpose suddenly. People crave purpose. The idea of finding joy or being happy is sometimes confused with what amounts to escapism, or not living in the moment, but always for a later and better moment. This new century has given us the ability to multitask, and with all the tools that can be used to free up time and maximize efficiency, there still doesn't seem to be enough time in the day for our modern lives. It is possible that through innovation we've made finding purpose a little more challenging, as survival itself was enough to consume most of our waking hours not that long ago. At this time in history, we have many things to be grateful for. Sanitation and running water are a good start to that. But our problems are not any less real just because people in the past faced more of a grim reality. A constant reminder that this is the greatest time to be alive in history can be used by some people as a distraction and an almost type of self-shame by using comparison to a past or present reality, whether real or scripted, as a distraction from their own reality. Whether it's the internet, movies, the news, or magazines, people have a parallel world they've created of drama, harsh reality, and laughter, combined with advertisements that can be designed to fill our voids, such as food, products, medication, anything on Amazon. Our society is medicated in so many ways, it's hard to imagine just how much our brains have this chemical bombardment all day long. When people use nicotine, alcohol, antihistamines, people are prescribed thousands of drugs a day, from anti-anxiety to antidepressants. Herbal supplements are sold on the market as a safe alternative to many of these things. There's also the outside influences that are all around us, such as smartphones and more technology requiring an internet connection to even perform its function. Many of these devices are admittedly addicting, and some of the programs being used were specifically designed to trigger a reward center of the brain that controls dopamine, and it correlates with habitual alcohol use. The opioid and pain epidemic, both emotional and physical, deserves attention altogether, as well as the relationship that's coming more clear as we keep researching it and finding more about this. Drug use, depression, suicide, pain, and hopelessness, all mental disorders, are all on the rise. These heart-wrenching situations that face you, or family members, or friends around you, the statistics are too overwhelming for it to be any other way that you have this by you. Almost half of Americans are in chronic pain, and a third so severe that it limits work and life activities. Emotional and mental disorders aren't even included on this list. Suicide is the 10th leading cause of death in all age groups. 123 people take their own lives every day. These numbers should tell us something. You are not alone. Many things can fall under the category of pain, especially considering the consequences, both for people suffering and from other people around them. Before I offer some interesting solutions to lack of purpose that leads to addiction, I want to make it clear there's enough evidence to suggest that drugs are not the underlying problem in most cases of addiction, but rather an attempt for someone to solve a problem. This is well demonstrated by a specialist in addiction, Canadian physicist and medical doctor, Dr. Gabor Mate, in a book, The Realm of Hungry Ghosts. He gives a lot of evidence that challenges the old ways of looking at addiction, but we're still using the old model of addiction as a disorder of choice in the way we treat addicts as criminals rather than patients. Even those in pain and potential drug-seeking addicts who might fit a particular profile. Since both drug dependency addiction and addiction are so prevalent in society, most people can attest they know someone or who the problem did not become apparent for some time, even though it may have been a family member under the same roof. People are usually quite successful at masking their problems in the short term, using drugs or other types of coping mechanisms to self-medicate. People don't often spin out of control because of an overproduction and overprescription of pain pills after a surgery that causes someone to suddenly leave a successful life to pursue an ever-increasing physical need to be high, all the while self-destructing. It just doesn't make sense. There are many people to blame for in today's narcotic abuse problems, both over the prescription medicines and illicit users. There are many victims in the effort to fix the problem, including those in real pain seeking their medicine, having their medicine they seek cut back or taken away altogether. I'd like to talk about a possible solution now that I've seen great effects with, even in the infancy of its creation. Virtual reality, a possible new drug of the future. Technology has been developed that uses sound, frequencies, and imagery that alone or combined with meditation has been shown to relieve pain and release natural morphine or endorphins and other positive chemicals into our body. Another treatment to addiction is psilocybin, the active ingredient in magic mushrooms. Recently, these were mentioned on the news, as you might have heard, that Colorado has decriminalized them. Psychedelic-assisted psychotherapy, or PAP, which is actually working with a therapist under the influence of a psychoactive drug, has been around for quite a while. In the United States in the 60s even, LSD was the catalyst for modern psychiatry, and most successful research was happening, and until the war on drugs took effect, it stopped. Leaving aside any personal feelings about legalization of drugs, recreational or for medical use, the fact is that the clinical use of many hallucinogens is showing very positive results. People report repressed memories being brought to the surface, help with addiction, and even easing the fear of death in terminally ill patients after just one use. The benefits of this type of therapy increase quite a bit when virtual reality is brought into the picture. It can mediate one's experience to their individual needs, and maybe one day eliminate the need altogether for a patient to be out of his or her own house and receive nearly the same kind of therapy. We now have the technology in our hands that can allow people not to suffer through their pain, but to live more than just survive. Let's consider this soon approaching virtual world. If we imagine it as a personal transportation tool, a medical tool, in addition to simply entertainment, it may help society make a paradigm shift in our way of thinking about reality itself, as our future is changing quickly. Ideas that would have seemed ridiculous just a short time ago are popping up all around us faster than most people can keep track of. If we have the opportunity to give people some kind of a life, even a virtual one, we owe it to those confined to their prison of their own making and pain to give them the opportunity to set themselves free and judge the consequences for themselves. This could give them a purpose. If you have a loved one or are suffering yourself, I would highly suggest looking into virtual reality therapy and possible magic mushrooms, even if they're prescribed in your area. We all have the right to a purpose-driven life. A new type of reality may soon be able to do just that. Thanks for listening. Bye.